This program is made possible by grants from Humanities Kansas and the Sunflower Foundation in partnership with the Geary County Historical Society.
This is Pandemic on the Prairie, a podcast about the 1918 influenza pandemic in Kansas and what local stories tell us about the American experience more broadly. I'm your host, Kara Heitz. Join me as we learn about this important moment in history and perhaps through the past, come to better understand the present. So I recently took a trip to Topeka to visit a monument connected to today's episode. My colleague Emily came with me on that especially windy day. So we're here at the corner of Age Street and Van Buren in Topeka, just across the street from the Capitol, looking for the statue of Dr. Samuel Crumbine. As we approached the statue, we could see phrases inscribed into the tiles on the pavement. Don't spit on the sidewalk. Ban the public drinking cup, swat the fly, bat the rat, out with the common roller towel. We also have, in the long run, lasting victories are won by telling people the truth. That's an important statement in our time, too. And we suffer from disease through ignorance. We may escape through knowledge. And right in front of the Kansas Health Institute is a statue of Samuel Crumbine, standing on a box, holding his hat in his hand, and kind of looks like maybe, I don't know, what do you think, Emily? Is he addressing a crowd, maybe?
Seems like it. He's got his arms out.
Yeah. Please stop spitting on the sidewalk, I beg of you.
I think if he were alive now, he'd be making this gesture and begging people to wear their masks.
Which makes me think I should put my mask back on now since we're done recording. So who exactly is this guy, and why is he important enough in Kansas history to get a statue right across the street from the state capitol? Today we're telling the story of Dr. Samuel Crumbine, Secretary of the Kansas Board of Health for almost 2 decades in the early 20th century and considered by many a medical pioneer. But unlike most other famous physicians, he didn't discover the cause of a disease or invent a new medicine. He's famous for something else.
Samuel Crumbine was a nationally renowned figure in public health.
And the methods he used to prevent the spread of diseases were innovative and quite creative for his time.
Crumbine was a public relations genius for his era.
He also oversaw Kansas's response to the influenza pandemic of 1918 to 1920, and much of his approach to that pandemic is still applicable today.
It's 100 years later, and we're still giving 80% of the same advice that Samuel Crumbine was giving people back then.
However, his actions were not without controversy. We'll also look at some policies he set in motion that would be considered pretty unethical from a contemporary perspective. And we'll think about how one understands the legacy of a figure like Dr. Crumbine, who did so much good and positively affected the lives and health of so many Kansans, but also supported some highly questionable and ultimately discredited policies. Samuel Crumbine was born in 1862 in Emlenton, Pennsylvania. His father, also named Samuel, was a blacksmith who served in the Union Army during the Civil War. The elder Crumbine was captured and died in a Confederate prison before his son was even born. So Samuel was raised by his mother Sarah and his maternal grandmother. When he turned 21, Crumbine began his medical training at the Cincinnati College of Medicine and Surgery. Upon graduation in 1888, he headed west to set up medical practice and settled in Dodge City, Kansas. Crumbine arrived in town right in the middle of the era of wild and woolly Dodge. He describes it as a lively place full of cowboys, merchants, traders, railroad workers, ranchers, hunters, gamblers, confidence men, and, quote, women of ill repute. And as a town doctor, Crumbine saw plenty of this infamous side of Dodge.
The daily life of the frontier doctor was usually interesting, sometimes difficult, and occasionally hazardous. But his right to enter doubtful places like gambling rooms and dance halls was unquestioned, for he was considered a neutral in the disputes and the feuds that occasionally enlivened the life of gay and fascinating Dodge City.
Crumbine's adventures in the cowboy capital, which included encounters with famous figures like Bill Tillman, Wyatt Earp, and Bat Masterson, are recounted in great detail in his 1948 autobiography, Frontier Doctor. I highly recommend picking up a copy if you're interested in the Old West and Kansas history. It's actually quite a read. And someone working for the CBS network must have also enjoyed reading his autobiography, as Dr. Samuel Crumbine is supposedly the inspiration for a character on one of the longest-running TV shows in American history.
Oh.
Well, that wouldn't happen if you got some of those nails that don't bend.
Doc, ain't there somebody around Dodge that's got an old sick cow that you can attend to somewheres?
Well, now, that wouldn't happen if you held onto the hammer with both hands.
Yes, that's right. Doc Adams on Gunsmoke is based on Dr. Samuel Crumbine and his years as a Dodge City frontier doctor. Kind of cool, right? Besides attending to the after effects of saloon brawls and shootouts, a lot of Dr. Crumbine's practice in Dodge City was just typical rural small-town doctor work, treating people with infectious diseases, delivering babies, setting broken bones. But as a scientifically trained physician, and at a time when many physicians were not well trained in scientific methods, a lot of things he saw on the frontier bothered him. The widespread use of ineffective patent medicine was one of them. Two of my favorites sold in Kansas in that era were Mrs. Winslow's soothing syrup bottle and Dr. Perdue's Og Cure. I wonder what those tasted like. He also was troubled by the persistent belief in certain home remedies and folk medicine, like sassafras tea for purifying the blood, or using bloodletting to treat a variety of ailments from pneumonia to cancer. These were all common practices in the late 1800s. And Crumbine also witnessed the outbreak of many highly contagious diseases, like smallpox, diphtheria, and typhoid fever, which he rightly connected to the unsanitary conditions of life in a bustling frontier town like Dodge City at the time. These experiences would shape the rest of his professional life as a champion of public health.
One of my earliest convictions in relation to a productive and useful public health program was that one of the chief functions of state and local departments of health is to interpret the scientific knowledge and facts of preventive medicine and public health in simple terms understood by the man on the street, and to guide his thinking and the application of such knowledge to everyday life by every means available. For ignorance and age-old customs, habits, and superstitions yield only when new desires and ideals are created that make for clearer thinking and motivate action in better habits of living.
In 1898, Crumbine had the chance to put these beliefs into action when he became a member of the Kansas State Board of Health. The board itself had just been established in 1885, initially with only a small budget and a small part-time staff. But the very existence of a state board of health in the 1880s in a frontier state was quite notable. So Crumbine left the life of a frontier doctor in 1904 and moved from Dodge City to Topeka to work full-time for the Kansas Board of Health. He became the secretary, which was basically the head of the board, a position he maintained until 1923. So he was kind of like the Anthony Fauci of Kansas in that era. And after he takes over the board, he is always pushing for more money and more resources from the state for public health initiatives, something that is gaining traction across the United States in the early 20th century. So, why is public health an increasingly popular idea in the early 20th century? To help explain this context and Dr. Crumbine's role as a public health pioneer, I talked with Jason Rowe. Jason is the digital history specialist at the Kansas City Public Library and has a PhD in U.S. history from the University of Kansas. So, Jason, can you tell us why the idea of public health is gaining popularity in Crumbine's time?
So Crumbine, he was plugged into a larger national public health movement that had its origins in the germ theory of disease. So, the people's understanding of infectious disease had really shifted by the late 19th century. And scientists had determined that there were public health measures that could really go a long ways to suppressing infectious disease. By 1900, most states and cities had public health departments established, and they sought to influence construction of sewers and other hygiene infrastructure. And they coordinated testing and lab work. They would administer vaccinations at low cost. There actually were some vaccinations at the time. And the emphasis was on, it was pretty straightforward. It's cleanliness, hygiene, fresh air. And for infectious disease, it was tracing the spread of disease, and they would quarantine the carriers of disease. They would close businesses, and they would close other public spaces like churches and schools to fight disease outbreaks. And it's also important to remember that this was during the Progressive Era. This is when safety laws and regulations were being adopted everywhere to an unprecedented extent. So reformers were also, battling against child labor and business monopolies. So there is this broader context of government intervention in people's health and lives that hadn't really existed before. And that's what Samuel Crumbine is really at the leading edge of.
In this progressive era climate, Crumbine focused the efforts of the Kansas State Board of Health on creating public health campaigns to encourage people to live more hygienic lives and prevent diseases from spreading in the first place. I talked more with Jason Rowe about some of the most famous examples of campaigns launched by Crumbine.
Crumbine was a public relations genius for his era. And I have several examples. In 1906, Crumbine was at a baseball game, and he heard a fan yelling to swat the ball. It was a fly ball. And he kind of associated these words and put them together, and he coined this phrase, swat the fly. That term was not in widespread use in the early 1900s. And of course, scientists already knew that houseflies could carry diseases like typhoid fever, cholera, and they believed even anthrax. So, Crumbine kind of started this swat the fly.
Crumbine's fly swatting campaign then got a boost from a new invention by a fellow Kansan. Crumbine himself recounted the details of this story.
One day I got a letter from Frank H. Rose, a school teacher of Weir City who had just organized a troop of Boy Scouts. He said he had read about our campaign and asked if his scouts could be of any help. We sent literature, plans, and a model anti-fly ordinance. The town was divided into districts, and a group of Boy Scouts with rakes, hoes, and shovels was assigned in each district to haul away the accumulated garbage, manure, and house and alley rubbish. By night, Weir City was really clean, and then this scoutmaster really went into action. He bought a roll of wire screening. He cut it into small squares and tacked a square to a piece of wood made from advertising yardsticks he had begged from the local druggist. Then his boys delivered one of these fly-killing bats to each house in town, and thus was born what was later known as the fly swatter.
Wow, so Crumbine popularized the fly swatter, which is something I'm sure many of us have in our house right now. I know I still use it all the time in my kitchen when the weather is nice and I keep the windows open for a little too long. So how exactly did Crumbine communicate this information out to the public? Where did the Boy Scout leader read about the anti-fly campaign? And how did people in Kansas learn to swat the fly? Jason Rowe explains.
So the year before that, the State Board of Health had actually started circulating a monthly pamphlet that was called the Bulletin. So this gave them a direct connection to the public across the state. They were printing it and sending it out every month. And the early years, they were imploring people to swat your flies, put screens on the windows to keep the flies and other mice and pests out of the house.
The monthly bulletin of Kansas State Board of Health was our most important instrument in keeping the public informed of public health problems of the state and how and why we were trying to meet those problems. Our mailing list included doctors, teachers, editors, legislators, manufacturers, and dealers in food and drugs, leaders of social and civil groups, and any citizen who requested the bulletin.
And it was through this bulletin that Crumbine launched a number of other public health campaigns, some quite effective and some more popular than others.
One of Crumbine's slogans was, "Don't spit on the sidewalk." And that almost kind of ruffled some feathers for people because the polite phrase was expectorate. Spit was the vulgar phrase in those days. But you can't really print the word expectorate on a brick. And that's exactly what Crumbine wanted to do. He printed the phrase, "Don't spit on the sidewalk," and they put that on bricks. So, he worked with the brick manufacturers to make that happen. I mean, it's still possible to be in a town in Kansas, and if you find an old brick sidewalk, that phrase may be on there.
So this campaign did receive some pushback, as spitting was extremely common in those days. I keep thinking of all those full spittoons Crumbine must have seen in his Dodge City days. Yuck. The fact that saliva can carry germs was just not common knowledge then. But through Crumbine's efforts, it became more widely accepted in Kansas to not spit in public. Side note, I actually have one of these Don't Spit on the Sidewalk bricks in my office, and it's really cool to see Crumbine's work in person. My husband actually got it for me as a birthday gift, and this is the kind of present that makes history nerds like me really excited. I'll put a photo of it up on the episode webpage so you can see what it looks like. So Crumbine continued his public health work throughout his tenure as Secretary of the Kansas Board of Health by targeting other common disease-spreading practices of the time. Again, here's Jason Rowe.
So in 1909, Crumbine shifted his focus to another menace, which was the common drinking cup. So at the time, trains and other public venues would have an open vat of water and a drinking cup on a chain that everybody would share. It's just hard to imagine today, but people are set in their ways, and that's just common, and not everybody's carrying around water. They didn't have water fountains everywhere. So, Crumbine, he said that he witnessed a man with tuberculosis symptoms, drink out of the cup. And then right after him, a small girl came up and drank out of the cup behind this man. And this was on a train, apparently. So he saw this, and he got the state of Kansas, they banned the common drinking cup in 1909. And within 3 years, 26 other states followed along. Yeah, they were the first in the country to ban the common drinking cup.
As Crumbine himself recognized, it's hard for people to change their habits and behaviors. If you've done something a certain way your whole life, like spit on the sidewalk or drink out of a shared cup, it's often difficult to accept that this is not a healthy practice.
It is curious how age-old custom and habits so often control the thoughts, actions, and daily routines of people, even after science has voiced a note of warning, and good breeding has raised the brow of doubt as to good manners and decency.
So why did so many of Crumbine's campaigns work? How did he get people to change their entrenched habits? Jason Rowe explains that Crumbine's campaigns were most effective when he was offering a workable alternative or easy replacement for the old behaviors.
In the case of the common drinking cup, the replacement was the paper cup. So it was another private citizen from Kansas who approached Crumbine. His name is Hugh Moore, and he handed him it was kind of like a waxed paper cup. It was just folded, and I mean, we've all seen them and used them. It was cheap and disposable. You could put them anywhere. It's hygienic. Probably not good for the environment. One problem at a time. Eventually, there was the Dixie Cup Company started producing these things and distributing them worldwide. And so years later, they actually produced kind of a a certificate and presented it to Crumbine, just thanking him for inventing or helping invent this product.
One of Crumbine's last major public health campaigns was eliminating the shared roller towel. Like the common drinking cup, many public facilities would have a shared towel. So if the exposed section was wet, you would just roll it around to a dry section. But there is only a limited amount of towel to roll, so it's a really great way to spread germs. And also like the drinking cup, there is an easy and workable alternative, which are disposable towels and later electric hand dryers. These were simple changes, but highly effective in fighting the spread of communicable diseases. Also, just another side note, think of how much the idea of sharing drinking cups and hand towels with hundreds of strangers really grosses us out in present time. That shows us how ingrained in our society these public health ideas are now, so thanks, Dr. Crumbine. But not all of Crumbine's public health campaigns were widely successful. There was one in particular that really did not go well at all.
In 1914, his public relations kind of failed him with the Bat the Rat campaign. People were all too happy to swat flies, but nobody wanted to bat the rat. You can't win them all.
So no batting the rat, I guess. But kidding aside, while we often associate Crumbine with these PR-friendly campaigns, his public health efforts extended well beyond just catchy phrases. Under his tenure, the Kansas State Board of Health implemented a number of important policies to do things such as combat food and drug impurities, improve the quality of water, elevate the health of children, and even promote sex education in high schools. You can imagine the kind of resistance this idea received at the time, considering it's still controversial today. And partly because of the efforts of Crumbine and the State Board of Health, Kansas had an outstanding national reputation in the field of public health in the early 20th century. For example, in 1920, the life expectancy of a white male in Kansas was the longest of any state in the country. One of his slogans that is inscribed near his statue in downtown Topeka is, "We suffer from disease through ignorance. We may escape through knowledge." That really sums up his approach, and that still holds true today. One of the most significant public health crises faced by Crumbine was the influenza pandemic. If you remember from previous episodes, the first wave of the flu began in the spring of 1918, but it was relatively short-lived and not very deadly. The second wave, coming in the fall of 1918, is what we most associate with the pandemic. The flu strain had mutated into something much more deadly at this point. It hits the U.S. East Coast in late August and September of 1918, and more inland states like Kansas start preparing for the inevitable arrival of the flu. I discussed with Jason Rowe how Crumbine and Kansas dealt with this second wave of the influenza pandemic.
So by the time the flu hit Kansas in early October, the State Board of Health had a few weeks' notice that something was coming, and it was labeled influenza, but others were kind of arguing about what exactly this is. They had no vaccine for the flu yet, and they didn't even have antibiotics to treat secondary infections that would cause pneumonia. So the Kansas State Board of Health, they didn't have anything to really treat people once they got it. The best they could do was prevention, and that was Crumbine's forte. That's what he was the best at. So Kansas State Board of Health, they jumped right in by October very quickly, and they're very aggressive, working with cities and at the state level. They implemented quarantines. If you had flu symptoms, by law, you had to be quarantined. They closed businesses and public facilities all over the state. So this would include schools, hospitals, churches, movie theaters. And of course, just like today in 1918, some people resisted this.
These statewide business closures lasted about a month in Kansas during the onslaught of infections in October and November of 1918. but the power to quarantine was used by state and local government officials throughout the duration of the pandemic, up until the last wave of the flu hitting Kansas in early 1920. We'll actually be talking in more detail about policies like closing orders and quarantines, and Kansans' reactions to them in a future episode, so be on the lookout for that.
There were a couple of movie theaters in Lawrence, Kansas that stayed open initially. And Crumbine ended up working with the head of the SATC, which was Student Army Training Corps. It's the predecessor of ROTC. And they forced the theaters to close. I mean, that's literally military involvement in Kansas public health. So that's how seriously they took it.
Besides trying to limit the spread of the flu through measures like business closures and quarantines, Crumbine did use his tried and tested methods of public education, circulating lists of preventative measures suggested by the Kansas State Board of Health.
Enough is known about the disease to offer the following suggestions, which it is thought will be of material assistance in avoiding contraction of the disease. 1. Avoid crowds as much as possible. 2. Keep your hands away from your mouth and nose. 3. Cough and sneeze into a handkerchief. 4. Always thoroughly wash your hands before eating. 5. Take plenty of sleep on a sleeping porch if possible, or in a well-ventilated bedroom. 6. Avoid excesses of all kinds, either in eating or drinking, particularly doing anything that will occasion undue fatigue, either mental or physical. In other words, lead the simple life. 7. Keep the bowels open, the feet warm, and the head cool. 8. Dress comfortably, but not too warm, neither too scantily. 9. Be courageous. Be not afraid, but do not be foolhardy. The submarines of disease are still our formidable foes.
In my research, I've seen this list and similar ones from Crumbine's office printed in almost every newspaper across the state, in local Red Cross publications, and in the State Board of Health's own bulletin. Of course, today, a lot of this is just common sense when trying to fight infectious diseases. Well, maybe not number 7 anymore. I asked Jason Rowe his thoughts on the familiarity of this list.
A lot of the innovations that in just basic preventive public health, that they had already developed those, and we're still using them today, is really our primary response when a new disease like the coronavirus comes up, and it's 100 years later, and we're still giving 80% of the same advice that Samuel Crumbine was giving people back then.
How very true. Even though today we have the widespread use of vaccines, effective antibiotics, and lots of medical advances that can treat the seriously ill, it's kind of amazing and even a little scary how we're still following these century-old common sense measures with contemporary pandemics. But even though much of Crumbine's career is well regarded, there are controversial aspects of his work, and these are occurring around the same time as the flu pandemic. And like the flu, they are also deeply intertwined with the U.S. involvement in World War I. I asked Jason Rowe about Crumbine's work during the war.
So the pandemic was deeply tied to World War I. I mean, you can't really separate the two, because during wartime on this unprecedented scale, soldiers are moving around the world, and as they're going on trains and ships, they're taking the disease with them. But when the U.S. entered World War I, Samuel Crumbine was still the secretary of the Kansas State Board of Health. He had been for something like 15 years by this point. And they selected him to be on the Kansas Draft Board. And among other things, the board had to make medical determinations. What is the standard of medical health to be eligible for the draft and go serve in the war? So Crumbine's kind of in the thick of this.
So, in addition to fighting the influenza pandemic, which is spreading quickly worldwide because of the war and troop movement, Crumbine is focused on the health of soldiers. And remember, Kansas is home to Fort Leavenworth, Fort Riley, and at the time, Camp Funston, a large World War I Army training camp, and possibly an origin point for the first wave of the flu pandemic. If you want to hear more about this story, you can go back and listen to our episode, The Kansas Flu. But the flu was not the only threat to soldier health. Another significant one was venereal disease. Many soldiers stationed in Kansas, in places like Fort Leavenworth, would visit Kansas City, Missouri in order to drink, gamble, and, unsurprisingly, visit prostitutes. So Crumbine made a trip to Kansas City to get them to enforce its prostitution laws, a trip which eventually led to an encounter with a famous and colorful local political figure who also just happened to make a lot of money off of liquor, gambling, and prostitution. Here's Crumbine's recollection of that trip.
And then began the most amazing trip I ever took as a health officer. We presented the situation to the mayor and requested he should issue on order for the arrest of all prostitutes and the quarantine and treatment of the infected under the penalty of quarantine of the city for all soldiers. He said that he was sorry, but the police was under the Metropolitan Board of Police Commissioners. Then we went to the police commissioner's office, where we were advised that the police could do nothing. Why? Because when the police arrested a prostitute, the city court let her off with a suspended sentence or a small fine. Well, whom should we see at the city courts, I asked him. Why not see the man who owns them, he demanded. It was not long before we were in the presence of the great political boss, Tom Pendergast.
And he ended up sitting down, had a meeting with Pendergast, and Crumbine brought leverage with him. And remember, Crumbine is the secretary of the Kansas State Board of Health, and he's sitting in Kansas City, Missouri, with Tom Pendergast. I mean, Crumbine has no jurisdiction here legally, except that it's wartime. And Crumbine threatens to have the Surgeon General ban soldiers from entering Kansas City.
I said, I will give you just 1 week to have the city courts hold all arrested streetwalkers and body house inmates for examination, and if diseased, they are to be quarantined and treated. You won't have to wait a week, doctor, the boss said. If the courts aren't doing as you wish by this time tomorrow, let me know. But don't put the city in quarantine, for I promise you that your wishes will be carried out to the letter. They were that same afternoon.
So even though Pendergast had seemingly unlimited power in Kansas City, he didn't have that much power. Crumbine was able to get Pendergast to agree. Yep, Crumbine outmaneuvered Pendergast in that one instance.
I really like the thought of Dr. Crumbine getting a leg up on Boss Pendergast. But this story leads us to the more troubling part of his public health campaign against sexually transmitted diseases. Note that it's the women being arrested for prostitution and not the soldiers who are also involved. This certainly is not an uncommon tactic in law enforcement campaigns against sex work, even in present times. However, Crumbine's concerns about prostitution ran much deeper than just the health of soldiers, which takes us to the controversial topic of eugenics. The word eugenics comes from the Greek words for good origin or good birth. The eugenics movement believed the human race can be, quote, improved through the use of biological principles of heredity and genetics to create, quote, fitter populations. As one early 20th century eugenics organization put it,
our goal is to improve the natural, physical, mental, and temperamental qualities of the human family.
And even though we now know the science behind it is quite flawed, eugenics was an incredibly popular movement in the early 20th century, and is connected with many prominent and respected doctors, politicians, public figures, and public health reformers of the time, including Samuel Crumbine. Here are Dr. Crumbine's own words from the October 1918 issue of the Bulletin of the Kansas State Board of Health.
Each youth who grows up and marries becomes a link in a great chain of human beings. This chain reaches back into the past for thousands of years, and it may reach forward into the future for an even longer time. One false step may infect the racial stock and blight the lives of generations to come. If the young man keeps his body in good condition and lives a clean life, his descendants will, in all probability, be vigorous and useful citizens. The spark of life is to be accepted as a sacred trust to be transmitted undimmed to future generations.
We can think about eugenics as having two forms, positive and negative eugenics. Positive eugenics measures were aimed at better enabling individuals who were deemed, quote, fitter to reproduce, to pass along their genes. Popular campaigns at the time to promote clean living and healthier babies fall under this category, and Kansas was at the forefront of this. In the 1920s, eugenics organizations sponsored a number of fitter family competitions at fairs and festivals across the country. The first one ever was held at the Kansas State Free Fair in 1920. I'll put a link to photos and other materials from the Kansas State Free Fair in the episode website for those who are interested in learning more about this. So to help us better understand this connection between Crumbine and the eugenics movement, I spoke with Christopher Lovett, a historian and professor of social sciences at Emporia State University. Professor Lovett has researched and written about some of the more morally questionable aspects of Dr. Crumbine's work. And I do apologize for the poor audio quality of my interview with Professor Lovett. Because of the COVID pandemic, we did the interview outside. And as you know from the beginning with our visit to the Crumbine statue, it was a really windy day.
When you look at his record dealing with infant care and infant mortality, he's an advocate of fitter babies, good family life, and hygiene for infancy. He's really motivated about reducing infant mortality. At the same time, he's very concerned about exposing children to bad influences and families to disease, women, etc.
Removing exposure to these, quote, bad influences is part of negative eugenics. Of course, one problem immediately clear is how to even define a bad influence. Who is diseased or unfit, and why? And from a eugenics perspective, you don't just want to protect the, quote, fit part of the population. You also want to limit or even remove the reproductive ability of individuals and groups perceived to be unfit. For eugenicists in the early 20th century, the genetically, quote, undesirable were often individuals with physical and intellectual disabilities. But in some cases, the unfit were also classified as the poor, criminals, immigrants, and non-white peoples, as their perceived undesirable qualities were, wrongly of course, believed to have genetic origins. Professor Lovett explained to me how Crumbine's wartime campaign against sex workers was part of a larger agenda to apply eugenics principles to public health policy. And the opening for this agenda in Kansas?
In April of 1917, a young girl named Edna Dinsmore was murdered in Topeka by this guy named Fred Bissell. Fred Bissell was earlier pardoned by Governor Arthur Capron for what they call crimes against nature, which today we would classify as sodomy. And he raped her, tried to dispose of her body by setting a building on fire. And he was eventually arrested.
Fred Bissell's murder of Edna Dinsmore and his repeated crimes of sexual violence outraged Kansans. After his arrest, mobs in both Topeka and Lawrence tried to lynch him. We now know genetics don't cause these kinds of behaviors, but eugenicists at the time thought otherwise, and so the case became a catalyst in Kansas for giving the state more power to forcibly sterilize certain individuals. Previously, in 1913, Kansas had passed a sterilization law that targeted, quote, habitual criminals, idiots, epileptics, imbeciles, and the insane. At first, forced sterilization was not a power used very often. It required judge approval, which could be difficult to get. However, after the murder of Edna Dinsmore, Crumbine and others pushed for a law giving doctors, not the courts, the ability to decide who should be sterilized.
And Samuel Crumbine and others thought that the best way of eradicating these sort of people would be bypassing the judge and let doctors make the decision. And so the Kansas legislature, because the Edna Dinsmore murder, passed that law. And matter of fact, the first thing he does is sends an alienist from Rosedale, which is a psychiatrist, to go to Lansing to pick out like 9 individuals that would be candidates for sterilization.
In total, over 3,000 individuals were forcibly sterilized in Kansas between 1913 until the end of this policy in 1961. Of course, the state of Kansas was in no way an anomaly in this. Eugenics was a nationwide, actually worldwide movement. In total, over 70,000 individuals were forcibly sterilized in the United States during the 20th century. The U.S. Supreme Court even upheld the constitutionality of forced sterilizations of individuals with certain kinds of physical and intellectual disabilities. But Kansas does rank 6th in the United States in terms of the total number of forced sterilizations. Yay, go Kansas. And while the majority of those sterilized in Kansas were male, women in Kansas were uniquely targeted in a very distinct way. Because the reason many of these women were incarcerated in the first place? Crumbine's campaign against venereal disease. While it initially starts out as a program to make soldiers healthier during World War I through targeting sex workers, of course, which itself is problematic, but we'll put that aside for now. But this program expands to include all women suspected of having a venereal disease regardless of how they acquired it. Professor Lovett explains this policy backed by Crumbine of mandatory STD reporting.
If you suspected you had a venereal infection, you would have to go to your physician. And your physician by law had to report that to the Justice of the Peace. The Justice of the Peace would then notify the county sheriff or the chief of police, and he'd be incarcerated. Some of these women didn't even know it was happening.
So, if you were a woman who tested positive for an STD, or was even just suspected of having an STD by your doctor, the doctor was required to report you to the Kansas State Board of Health. And it didn't matter how you acquired it, through sex work, through an unfaithful partner, even through mother-to-child transmission. The State Board of Health would then pass along the names of the infected to the court system, who were then arrested for health code violations. And if you couldn't pay for treatment, you were incarcerated. And while the arrested women were not sent to the actual state prison facilities in Lansing, they were incarcerated at the nearby Women's Industrial Farm, a nice name for a prison for women. Professor Lovett described it as a prison without walls. And at the Women's Industrial Farm, some inmates were sterilized if they were seen as fitting into any of the categories eligible for Kansas sterilization laws. However, many other women were giving purported treatments for their STDs that were so invasive and even brutal, the process effectively sterilized them. And remember, while certainly some of these women had committed serious crimes like assault and murder, Professor Lovett estimates that around 70% of these women were incarcerated because of health code violations. In other words, of having or just being suspected of having an STD and not being able to afford treatment. While lots of individuals were involved with the passing, enforcing, and carrying out of these policies at every level of government in Kansas for a number of decades, Samuel Crumbine's efforts in the 19-teens were instrumental in establishing both the precedents of incarcerating women for, quote, public health code violations, and for making it easier for the state to carry out forced sterilizations on prisoners. Dr. Crumbine left Kansas in 1923 when he was offered the prestigious position of director of the American Child Health Association in New York City, an organization founded by then Secretary of Commerce and future President Herbert Hoover. In this position, Crumbine launched national child public health campaigns that made a real impact on infant mortality, water supply safety, and reducing the spread of serious diseases like tuberculosis. He stayed in New York after his retirement and maintained his reputation in Kansas and nationally as a pioneer in the field of public health, especially in regards to the welfare of children. And by mid-century, many of his public health campaigns were widely accepted, with fly swatting, paper cups, disposable towels, not spitting in public, covering your nose while you sneeze, seen nationwide as common sense. And also by this time, eugenics was a discredited movement made unacceptable by the horrific actions of Nazi Germany. Crumbine died in 1954, and the next year the Conference for Food Protection established an annual award in his honor, which is still given to this day. The description of that award states,
Crumbine left a lifetime legacy of contributions to public health that has rarely been equaled. The award, which carries his name, is not only a tribute to Dr. Crumbine's life and his accomplishments, but is a standard against which excellence in public health services is measured. If Dr. Crumbine was still alive, he would no doubt toast the award winner with a Dixie cup of champagne.
So, how do we understand the legacy of Dr. Samuel Crumbine? How do we reconcile his incredible work in the field of public health, including combating the flu pandemic in Kansas, with some of the highly morally questionable policies he put into motion? How do we account for both the thousands of lives he made better and even saved, and those who were unjustly incarcerated and even sterilized against their will? How do we remember and even celebrate historical figures with complicated ethical legacies? This is obviously a question we're actively dealing with in our society, whether it be with founding fathers who are also slaveholders, statues of Confederate generals in town squares, or pioneers of women's health who also actively supported racist eugenics ideas. Yes, I'm talking about Margaret Sanger. Ultimately, I go back to that one phrase of Crumbine's, etched onto the ground next to his statue in downtown Topeka. We suffer from disease through ignorance. We may escape through knowledge. I'd admit that to be even broader. We suffer through ignorance. We may escape through knowledge. Part of dealing with morally complicated history is to openly acknowledge, recognize, and discuss the good and the bad. To not brush the bad under the carpet and pretend it didn't happen, but to understand why it happened, partly to make sure it never happens in the future. Again, I quote Crumbine, "In the long run, lasting victories are won by telling people the truth." Thanks for listening to Pandemic on the Prairie. If you want to go further on this episode's topic and take a look at some of our sources, check out our website at www.1918flukansas.com. That's www.1918fluks.com. You can listen to all of our available episodes on the website, or you can listen and subscribe to Pandemic on the Prairie through your favorite podcast service. See you next time.
It was in 1919. Yes, men and women was